Okay, Latricia, just want to thank you in advance for participating in our career week. We appreciate you coming to speak to our youth and spreading your knowledge. I'll let you take it away. You're muted.
All righty. Can everyone hear me?
Yes.
Okay, great. So I'll be presenting to you guys as well as the students here at the facility. I'm at the facility. So thank you for having me. My name is Latricia Brown, and I am a licensed vocational nurse. Actually, this is my second opportunity to be here for your career day. I was here before COVID, maybe a few years before then. So I am a nurse. I went to Chaffey College. I started as a medical assistant. I did like an ROP program for medical assisting, which was very helpful financially. So I've been working at Kaiser for almost 30 years. I was a medical assistant for about 10, 11 years. And then they had a program at work that paid for me to go back to school to become an LVN. So that's the reason why I took that opportunity to become an LVN. I would say if you're going to do it, you might as well just go all out and go to be an RN. There's nothing wrong with being a medical assistant, a CNA or LVN, but time-wise, you might as well just become a registered nurse. Since I've been working there for so long, it wouldn't benefit me now to become a registered nurse because I would have to leave Kaiser to get my experience as an RN. And since I've been at Kaiser almost 30 years, that would mess up my retirement. And I'm looking more forward to retirement now than I am to be working. I've been at Kaiser for almost 30 years now. That was my first job. I did my extern there as a medical assistant. So that's just my home. So I enjoy it. Let's see, what else? It benefits me. I've been there so long now. I get 5 weeks vacation. This happens to be the week that I am on vacation. So we also get 40 hours of something that they call life balance, which we can not go to work to balance our life. That's not counted against us. We also get 40 hours of educational leave. So really, I get way more than 5 weeks. So, but I do work. I do enjoy my work. I work in primary care, which is the clinic that people come in for normal appointments, physicals, pap smears, chronic medical conditions, if you have blood pressure, diabetes, things of that nature. So I enjoy doing that as well. I have worked in other clinics. I've worked in pediatrics. I like working with adults, not kids. But everybody kind of find their niche of where they are, what they like. So I found that primary care works best for me. Let's see. Any questions at this time? Anyone? Okay. Let's see. What else? I went to, like I said, I went to Chaffey College. That was a 2-year program to become an LVN. In nursing, nobody understands what you're going through, but the nurses that are actually going through the program with you. It's very hard. It's not easy, but nothing in life is easy. I just say that whatever career decision you decide you want to go in, make sure you like it. Make sure that when you go to work every day, it's something that you enjoy. Because if you don't like it or you don't enjoy it, then it makes it harder for you to go every day. So just make sure that you're focusing on something that you are going to enjoy for the long term. What inspired me to become a nurse was my mom was a nurse. I have 2 aunts that was nurses. I didn't really realize that until I went back home to visit some of my family members. And I found a picture that showed my mom as a nurse, and then 2 of my aunts as a nurse, and then myself as a nurse. So I've always wanted to be a nurse. So that is why I became a nurse, helping people, caring for people. Take care of your family members, take care of your parents, because we all go back to a stage where we are gonna need you. So make sure you're taking care of your parents, make sure you're just not kind of pushing them in and dropping them off to their appointments and leaving them. It's important that you be involved with their care. Make sure that, you know, as they get older, as you get older, even at the age that you are now, make sure people know what your thoughts and wishes are. Make sure you can have something that is called an advance directive now, so that if anything were to happen to you now, that your family knows what your wishes are. You kind of think that you have time for those things, but tomorrow's not promised to anyone. So make sure you have those things in order. Let's see.
No, those.
What else here? No, those are, that's me, and some of my nursing friends in nursing college. We had a good time, but it was also hard work. Also, the other picture is, let's talk a little bit about COVID. That's me in the COVID tent. So COVID is still here. We're still dealing with COVID. So just keep that in mind, you know, when you're around people, you may not realize that you could be infected with COVID, but we're still dealing with it. It was a lot for us in the medical field to learn at that time. Once we were able to learn what was going on and how it was happening, then we were able to, you know, come up with the vaccines, which has helped tremendously. So just keep in mind, you need to be washing your hands. Everybody say you wash to the ABCs. So when you're washing, you want to say your ABCs, maybe 10 to 20 seconds, you want to wash. Also, when you're out and about, if you're coughing or sneezing, you want to cough into your arm. So you're going to cough like that. That way you're not spreading anything outward. But during COVID, we did learn a lot. I'm sure everybody has lost in some way, but we made it through and we're all here. So that is a blessing. And then we want to talk about what motivates me. Well, what motivates me is the fact of helping people. I truly enjoy helping people the best to my ability that I can help them. Children, adults, older people, you know, so that means a lot to me to be able to give my service to people to help. There are some things that I've seen that didn't quite sit with me. Just a quick story. We had a lady that was there, and it was just, sometimes it was the smell of things that are going on. I actually passed out trying to assist the doctor. I didn't know it was me passing out. I could hear everything falling. I could hear the trays falling, everything falling, but actually it was me passing out, not the patient. So, you know, you're going to see things that affect you, but it's a part of the job. You have to kind of brace yourself for things, know that you're going to see some things that affect you, pray about it and move forward. So one of the most important parts of my job is the fact that I help people. That's the most important. People, when they're sick, they're not feeling well, you know, they just want to get better. You have to really be compassionate. You have to be patient. Because when you're not feeling well, everybody has probably had a time where they're not feeling well, and you just don't really want to be, you know, bothered. You want to just go somewhere and heal. So the healing process is, you know, it's a process. So, and you have to allow yourself to go through that process. Some obstacles, I went back to school kind of later in life. So I did have children when I went back to school. I had 3 children. So it was very hard going to school, taking care of the children, getting them to where they needed to be. There are different events that they had going on. So, but if you don't stay with it, nothing lost, nothing gained. You just have to move forward and whatever, you know, obstacles that you are facing. And that's what I have to say in regards to obstacles. That's the picture there that I was talking to you guys about. That's me down at the bottom in the only color photo. My mom is up at the top of me, and then I have an aunt on the left and an aunt down below there. So that is my family of nursing there. So we've all kind of had that passion to help people. So that's exciting to me to know that I come from a family of nurses. You don't even realize it. I didn't even know that why I wanted to be a nurse, but apparently it's in my blood. So that is what that is all about. Those are just some fun pictures that I put in there. Those are my children over there. My daughter loves Harry Potter, so we had a Harry Potter party for her. I am an advocate for health. Make sure you're taking care of yourself. You only get one body. So you don't realize it till you get older and you be like, oh God, what did I do? Make sure you're drinking your water. Make sure you're replacing your nutritional gaps. It's important that you do that now so that when you get older, you're better. Your body is gonna last. It's not gonna break down on you. So exercise is important. Skin care is important. But what you eat is important. So start that now. Don't wait until later to try and go back when you should be working on it now. That's me and my best friend there, Blanchie. She invited me out today to be with you guys. That was at the last career fair. I think we were in Huntington Park. So that was us there. So just some fun pictures to see. And those are my grandbabies over there. I have two grandbabies, girls. That is London and Miss Zora. So they don't live local. So we do a lot of FaceTime, and well, they had to teach me all that because I'm not that great with all that. So, but we do a lot of FaceTime. I get the opportunity to see them there. So that's basically, you know, kind of how everything kind of rolls out. Takeaways, let's see, life lessons that your work has taught you. You got to be able to be professional no matter what field you're in, right? Because we're not going to get along with everybody. We're not going to maybe not like everybody. That's okay. But you need to be professional with the people that you are working with. Speak to people, say hello, good morning, how you doing? You know, sometimes they're going to speak back, sometimes they're not. If you have an issue with somebody, you know, go to that person, talk to that person, figure out what the problem is and move forward. Where do I see myself in 10 years? Ooh, I'm gonna be retired somewhere. I don't know where, but I'm gonna be retired somewhere. Once I retire, I do not plan on going back to work. A lot of people, because they don't plan, they have to go back to work. So make sure you're planning now for your future. It could be as simple as saving $10 a week, $10 a month, putting that aside so that when it does come the time for you to retire or travel or do some things, you have something set aside. So nursing has given me the opportunity to live the lifestyle that I would like to live. Of course, you know, the different levels that you are, you may get paid more. As an LVN, I kind of get paid maybe around $80,000 a year. That's not what we started out at, but you know, each year we do get a pay increase. We do get bonuses. So there's usually a lot of overtime, but you don't want to wear yourself out on overtime because it gets to be too much. So I've enjoyed it. I've enjoyed it a whole lot. Like I said, it's been almost 30 years. Kind of planning for retirement now. I'm going to see what that looks like. So basically, that's my story. Any questions?
Any advice for students or anything?
So for me, I say that the advice I would give you that if you're thinking about going into the nursing field, just go for it. What do you have to lose in anything in life? What do you have to lose? If it doesn't work for you, that's okay. You can try something else. But get started. You can just kind of graduate into it. You can be a CNA. A CNA is usually someone who works side by side with the nurse, usually in a hospital setting. A CNA usually is the one who takes the patient's vital signs and maybe take water, maybe help with baths, and then you kind of report to your nurse that you're working with. And our LVN, just one step above CNA, so you could do a little more. You can give shots, you can do different types of procedures. Then in an RN, RN is of course one step above the LVN, so their role is more like medical. As the LVN, you can't give any kind of medical advice. You can't really treat, you have to have an order to do anything that you're doing. But as an RN, you can assess the patient. It's really money. Really a LVN can do just about the same thing as a RN can do. So if you're gonna do it, just go for your RN. Just shoot for the stars. I mean, you might as well. So that's basically what the difference is. Of course, usually it's the nurse that is kind of running the clinic, not the doctor. The doctor is usually gonna look to the nurse for certain types of advice. So that's basically where we are as far as the different levels in nursing.
Well, thank you for sharing that. Latricia, you said your salary is around 80,000 for an LVN. Can you talk
Yes.
about how long the program took for you to finish?
The program actually took about 2 years to finish because I kind of went in with credits since I was a medical assistant. So you kind of get credits because you're already working in the field. So the LVN program was 2 years. Like I said, I went to Chaffey College. And there was a program that was set up for us that were already in the medical field to be able to just go in and start working. As a registered nurse, it's a little longer, about 4 years. But they go by quick, really quick. So.
Can you talk about the different areas in nursing you can work in, like geriatrics, pediatrics?
Yes, so I've worked in quite a few different areas. I've worked in primary care, which is what I'm in now. That's basically, we see healthy people, people who are coming in for physicals, maybe your arm hurt, your knee hurt, you stubbed your toe, things of that nature. I've worked in cardiology. Cardiology is for your heart. Usually people with pacemakers, that's something that helps your heart beat on time if your heart is not beating the way it's supposed to. I've worked in gastro. Gastro is more for your stomach issues, if you're having issues with your stomach. Pediatrics is with babies, small kids, usually up to the age of 12. 13, then you go to something that is called a teen clinic. I've worked in a teen clinic. So the amazing thing with Kaiser is that you can go anywhere. You just apply for the job and you kind of get it basically based on seniority. A lot of stuff is based on seniority. So, I've been in nephrology, ophthalmology, taking pictures of eyes. So the opportunity for you to kind of figure out what area that you really like is there for you, which is an awesome thing.
Thank you for sharing that. Do you have any last piece of advice for any students that are kind of on the fence about doing nursing or something in the medical field?
My advice would be just to go for it. Like, you won't know until you try it, right? And if you don't succeed, that's okay. Then you just refocus and figure out what it is that you want to do. A lot of people say, oh, I can't do it because I don't like the sight of blood. Well, you may not be in an area where you're seeing blood. I don't work in the surgery clinic, so I don't see a lot of blood or things of that nature. I don't work in maternity, so I have seen a baby born before. That didn't sit right with my stomach. That's how come I knew that wouldn't work for me. So, but there's other avenues that you can go into. So you don't have to be afraid of things of that nature.
Thank you. And Latricia, let's talk about the job market. If a student were to complete an LVN program, how likely are they to get a job as an LVN?
Oh, they're more likely to get a job as an LVN than they are for a medical assistant. The medical assistants, well, at Kaiser, I can't speak for other facilities, but at Kaiser, they're kind of zoning out the medical assistants because they can get more from an LVN or an RN. So that's why I say if you're gonna go for it, just go for it. You know, a medical assistant can basically just kind of room a patient as far as like a LVN, we can room the patient, we can do an EKG, we can give the shots, we can, you know, do a little teaching. And then of course the RN can do much more than that. So at Kaiser, they're kind of trying to zone out the MAs. So as they leave, they're not rehiring MAs. At Kaiser, everybody kind of start in on call, which is kind of hard because you don't really have like a schedule, you're just on call. When they call you, you gotta go. But that's just temporary because you know, pretty soon you'll get a full time, pretty soon you'll, you know, be in a home department. So that's why I say just go for it. If you wanna be in a nurse, just go for it.
All right. Anybody else have any questions on the Zoom chat while we have Latricia here? No? All right. I think we're going to summarize everything. Well, I want to thank you again, Latricia, for, gracing us with your presence and spreading your knowledge about, what it takes to be a licensed vocational nurse. And we hope to have you in the future if you care to grace us again.
Well, thank you for having me. I appreciate you and I appreciate all the fabulous students that are in this room with me. Thank you for listening to my presentation.
Thank you.